And those cases we are put in the second category, that is the imported malaria cases. For the malaria, as per the malaria elimination framework, we have to achieve the zero indigenous cases. Means there should be the zero local cases. If you look at this graph showing the distribution or proportion of the imported and the local malaria cases in Goa between 2013 and 2022. In 2013, almost the proportion was quite similar, 50-50%. Further, from the 2014 onwards, the number of indigenous cases has gone drastically down as compared to the imported cases because of the efforts by the National Institute of Malaria Research Field Station Goa and the Directorate of Health Service, different health centers which are located at the different parts of the state. Because of the quick detection and the prompt treatment of all the malaria cases. Because of the health facilities are available very close to the local population, we would able to control the malaria among the local population. Whereas it is very difficult to control malaria in the migrant labor population because they are spread out throughout the state, and there are also some asymptomatic carriers also are there in the migrant labor population. So they cannot be detected with our routine diagnosis tools, that's the RDT and the blood smear. So I will be talking about the asymptomatic and low density carrier infections in my further slides. If I talk about the distribution of the malaria cases between the two districts, that is the North and South Goa. State has two districts, that is North and South Goa. North Goa was slightly higher in the API as well as the number of cases reported between 2000 and 2021 as compared to the South Goa. The proportion of the Plasmodium vivax, so we have two parasites which are prevalent in Goa, that is the Plasmodium vivax and falciparum. The proportion of the Plasmodium vivax was 80%, whereas the falciparum was about 20%. And in both the districts, the proportion is quite similar. This is the map of the Goa with different PSCs showing the distribution of the indigenous malaria cases between 2014 and 2021. So it can be clearly seen here in the year 2014. Only the cities which are close to the coastal belt and wherever the developmental activities were happening in the 2014. So most of the